The upper leg consists of the pelvis or the hip, the femur, and the patella. 4 hip ligaments provide stability and mobility to the hip joint. Ligaments of the knee will be discussed in relation to the lower leg. So the pelvic girdle consists of 2 hip bones or 2 pelvic bones. The hip bones unite anteriorly at a joint called the pubic symphysis, and they unite posteriorly with the sacrum at the sacroiliac joints. Combined, the 2 hip or pelvic bones provide strong and stable support for the vertebral column, as well as the pelvic and lower abdominal organs. The pelvic girdle also connects the bones of the legs to the axial skeleton. Taking a closer look at each hip bone, and the hip bone of a baby is actually made up of 3 separate bones, separated or attached by cartilage. A superior ilium, which is represented by this creamy white colour up the top, an anterior and inferior pubis, which is represented by the purple, and an inferior and posterior ischium, which is represented by that reddy pink. By our early 20s, these bones fuse together and function as a single bone. Looking at the landmarks on the ilium and making up the superior border of the ilium, which is the largest of our 3 hip bones, is our iliac crest. We have mentioned the iliac crest in a couple of the previous recordings because we have a number of muscles that insert onto this landmark. So the iliac crest is this ridge all the way along here. At the anterior end of the iliac crest is this little projection here, which is called the anterior superior iliac spine. Just below it, we have the anterior inferior iliac spine. Now, the anterior superior iliac spine in particular, you can often feel at the front of your hip if you feel through your skin. On the posterior surface of the ilium is our greater sciatic notch. So the greater sciatic notch is this entire indent here. Through this notch, our sciatic nerve passes. And then on the medial surface of the ilium is our iliac fossa. And so the iliac fossa is the shallow depression on that medial side of the bone. The pubis is then the anterior and inferior part of the bone. The anterior and superior border is formed by the pubic crest. Superior to the pubic crest is this line of bone called the superior ramus of the pubis. And then inferior to the pubic crest is this line of bone called the inferior ramus of the pubis. The joint between 2 pubic bones is called the pubic symphysis. And we mentioned our pubic symphysis earlier in the semester when we talked about joints. The ischium forms the inferior and posterior portion of the hip. It's made up of an ischial ramus, which is this line of bone here, an ischial tuberosity, which is this thick, roughened part here. Our ischial tuberosity is often referred to as your sit bones, and so it's what you can feel touching the floor when you sit on a hard surface. And then we have the ischial spine, which is this little projection that sticks out just below our greater sciatic notch. 3 more landmarks of the hip that don't specifically belong to any of those 3 regions or those 3 bones, and they're the acetabulum, which is this deep fossa here that's formed by the junction of our ilium, our pubis, and our ischium. The acetabulum and the head of the femur articulate to form our hip joint. The obturator foramen, which is this hole here, and is the largest foramen or hole in the skeleton. And then the auricular surface, which we talked about briefly when we looked at the vertebral column and the sacrum. And so we have our auricular surface on both the sacrum and on the hip. And these two auricular surfaces articulate to form our sacroiliac joints. So you can see our auricular surface here, but it would also be on the sacrum within this joint here and within this joint here. Moving on to the femur. And the femur, which is also known as the thigh bone, is the longest, heaviest, and strongest bone in the body. Its proximal end articulates with the acetabulum of the hip. Its distal end articulates with the tibia and the patella. The shaft, or the diaphysis of the femur, angles medially. And as a result, our knee joints are actually closer to the midline of the body than our hip joints. And so you can see that also represented up here. At the proximal end of our femur, as I said, articulating with the acetabulum is our head of the femur. Inferior to the head of the femur is the greater trochanter and the lesser trochanter, which serves as a point of attachment for some of our thigh and our gluteal muscles. The greater trochanter is lateral, and you can feel this if you palpate the side of your hip. The lesser trochanter is inferior and medial to the greater trochanter. And this view that we've got here is actually the posterior surface. Now, on the posterior and proximal surface of the femur is a vertical ridge called the gluteal tuberosity. The gluteal tuberosity is this little roughened part here, but I encourage you to have a good look at this structure on the actual bones in the lab. The gluteal tuberosity then blends into another line or another ridge called the linea aspera. And both the gluteal tuberosity and our linea aspera serve as attachment points for several tendons of several thigh muscles. On the distal end of our femur, we have condyles and epicondyles, just like the distal end of our humerus. The rounded distal ends are our medial and lateral condyles. These articulate with the medial and lateral condyles of the tibia. Just above these condyles are our medial and lateral epicondyles, remembering epi means on top of. Our epicondyles are attachment points for ligaments of the knee. Now, on the posterior surface, on the distal end of our femur, we have the popliteal surface. The popliteal surface is kind of like the back of your knee, and it's just this little part here. On the anterior surface, at the distal end, between our two condyles is the patella surface, and this is the surface that articulates with our patella or our kneecap. The patella or the kneecap is then the small triangular bone located anterior to the knee joint. The patella is classified as a sesamoid bone because it's developed and is located in the tendon of our quadriceps muscles. The broad proximal end is called the base of the patella. So the base of the patella, when it's located within your leg, is closer to your hip joint. The pointed distal end, which is closer to your feet, is referred to as the apex of the patella. On the posterior surface, we have two articular facets, one for the medial condyle of the femur and one for the lateral condyle of the femur. And the function of the patella is to increase the leverage of the tendon of those quadriceps muscles, to maintain the position of the tendon when the knee is bent, and also to help protect the knee joint. Looking then at the ligaments, and we'll look at the ligaments of the hip now, and the ligaments of the knee, and then also the ankle in the next module. And at the hip, there are 4 ligaments that, along with the surrounding muscles, help hold the head of the hip into, the head of the femur into the acetabulum. The first ligament is our iliofemoral ligament, which runs from our anterior inferior iliac spine on the pelvis to the greater and the lesser trochanter on the femur. So this ligament actually has 2 little sections, and on the models in the lab, I think this ligament kind of looks like a pair of pants. This ligament helps prevent hyperextension of the femur during standing. We then have the pubofemoral ligament, which extends from the pubic portion of the acetabulum to just under the head of the femur. This ligament helps prevent over-abduction of the femur, so taking our thigh out too far. And then we have the ischiofemoral ligament, which extends from the ischial portion of the acetabulum to just under the head of the femur as well. And this ligament is slack during adduction, so when you bring the thigh down closer to the midline of the body, but it's tense during abduction. So when you lift this leg out to the side, that's when this ischiofemoral ligament will hold tight. The final ligament sits within the hip joint, and it extends from the fossa of the acetabulum to the fovea capitis, which is actually a tiny little indent on the head of the femur. So you can see it runs from here in the acetabulum to this little indent in the head of the femur. This ligament is called the ligamentum teres, and it helps hold that acetabulum and the femur, the head of the femur, in place.